Going to explore the anterior teeth surfaces towards you. First thing is the wrist rock. Start at the midline of the tooth with the tip on the tooth, not the point. We'll stay supragingival so you can see, and roll interproximally. Go on to the next tooth. Start at the midline, roll interproximally. We're exploring the lower anteriors, surfaces towards you. Rock the wrist and roll interproximally. Beginning at the midline and rocking.
But this is great, you know, when I look up, I can see it.
Anterior surfaces towards you. Start at the midline of the tooth and rock. Roll as you approach the interproximal. All surfaces towards you are worked on from the front of the patient. Surfaces away from you from the back of the patient. Turn away from me, please. Lead with the tip, not the point. Rolling interproximally. Rock the wrist.
Okay.
Lingual surfaces towards you. Use indirect vision. Rock the wrist and roll interproximally. Surfaces away from you. Sit behind the patient. Start at the midline. All right, surfaces away from you on the lingual.
Sitting so far back that
Use your mirror.
These are huge loving it too.
if I was ready to do it for Nina.
Yeah.
Posterior teeth will begin at the distal line angle. On the leading edge, we will walk it back on the trailing edge to explore the distal. Walk it back. Turn it to the leading edge. When we get to the mesial line angle, roll it, pivot up on the fulcrum a little bit, and roll it interproximally. Walk it back to the leading edge. At the line angle, come up on the fulcrum a little bit and roll it in. Start at the distal line angle. Walk it to the trailing edge. Come around and roll it in.
Oh yeah, nice.
Turn your head. Okay, the upper right facial, posterior, extraoral fulcrum, pointed mesially. Walk it distal on the trailing edge. Come back. Open the door. Roll it down. And the upper left facial, extraoral fulcrum, cup the chin. Bring the hand to the side and then start at the distalmost tooth. Adapt it to the tooth. Walk it back to the trailing edge. Walk back to the leading edge. Watch how the hand is pivoting on the fulcrum as it comes along towards the mesial. Upper anterior lingual surfaces towards you. Back up the fulcrum to the bicuspid. Use indirect vision. Start at the middle of the tooth. And rock. Rock and roll. Roll in approximally. The fulcrum moves along almost with every tooth. Upper left lingual, cup the chin. Intraoral fulcrum is acceptable as well. And I'll show both. Now for an intraoral fulcrum, you would fulcrum directly on the molars. But I think extraoral will be easier at this time. Upper right lingual, have the patient turn towards you. Extraoral fulcrum. The head turned toward you and then slightly lift it up. For the 11-12 Explorer, the technique is the same. The shank and the working end are just a little bit smaller. So we'll start at the middle of the tooth, splitting surfaces, and work towards you. All right, 11-12 Explorer. The technique stays the same. Upper right facial, pointed mesially, adapted to the tooth. Walk it back to the trailing edge. And roll it in approximately.